As the number of positive cases for SARS-CoV-2 increases, many of us would like to understand what can be done if we develop symptoms of COVID-19 after exposure, and what are the current best medical practices to preserve our health. What medical treatments could your doctor offer if your infection progresses?
Although a cure has not been discovered yet, there are some advances in the intervention of patients that we can implement if a COVID-19 diagnosis is determined. Like any other medical condition, decisions for the management of the viral infection are implemented on a case-by-case basis, and you should consult your physician for the treatment that suits you best. NIH experts have delivered a series of recommendations with the current evidence, and we went over the published scientific articles to explain what all this means for you. So please, get comfy and put your nerdy hat on because you're gonna need it for this one.
Health Facts Now. Your health at a click.
I'm Dr. Jonathan, and today we'll be talking about COVID-19 treatments. The infection timeline presents an early and a late phase. The early phase of the disease is driven by the viral invasion of the respiratory tract, and although it can affect other systems such as the nervous and gastrointestinal, it's the respiratory system complications that are the main contributor to the rapid deterioration of the majority of patients. In some cases, this is then followed by a severe inflammatory response, which puts the patient's life on the line and affects their ability to breathe on their own. These different stages explain why some treatment regimens are beneficial at a given point in the disease course, but useless or even harmful at all the disease stages. To estimate where you are in the infection, we use the disease severity scale, which is based on how much help you require to breathe. With this approach, we can divide a patient's presentation by first, no oxygen required, second, low flow oxygen delivery, third, high flow oxygen delivery, and fourth, advanced life support measures. There are three main groups of pharmacologic therapies that we will discuss based on the recommendations from current evidence. Immune-based therapies that modulate the hyperactive inflammatory effects from the virus, antivirals that directly disrupt part of the viral cycle, and adjuvant therapies, which are substances that might play a significant role in the treatment and prevent the infection or its complications. Several medications have been studied, but only one has shown a definite benefit on patients' mortality: dexamethasone. Dexamethasone is a corticosteroid drug that is very similar to hormones produced in your body. It works by decreasing the activity of several functions of the immune system, which in turn decreases inflammation. A large study from the UK showed the benefits of this medication on the treatment of COVID-19 patients that require oxygen. This benefit was most evident in patients that require advanced means of life support, such as mechanical ventilation or extracorporeal oxygenation. Researchers' findings determined a reduction in mortality risk of 11.7%, and estimate that for every 9 patients, 1 will benefit from this therapy. There was also a minor decrease in mortality from those requiring oxygen delivery by other modalities. In this group of patients, the reduction in the absolute risk of death was 3.5%, estimating that from every 29 patients, 1 will benefit from this therapy. On the other hand, dexamethasone was not beneficial when patients did not require oxygen. NIH's recommendations for this medication is then only for those patients that are hospitalized and require oxygen. Although this is far away from being considered a cure, it's the greatest benefit from any medication so far. Nonetheless, other medications are being tested, like bamlanivimab. Bamlanivimab is a monoclonal antibody that provides antibodies that neutralize the virus. The clinical trial that justified emergency use authorization by the FDA showed a reduction in the hospitalization in 72% of the patients with early diagnosis by PCR. In fact, if bamlanivimab was infused within 72 hours after a positive result, only 1.6% of the patients went on to require hospitalization, compared to 6% of patients that received placebo. A cocktail similar to this medication was in the news in October, as it was one of the medications the former President Trump received during his hospital stay. Other medication is the famous remdesivir, which works by decreasing viral replication. This makes the medication more beneficial at the early stage of the disease, as shown by the adapted to COVID-19 treatment trial. This study concluded that this drug decreases the time to recovery from 15 days on average to 10 days when patients require supplemental oxygen during hospitalization. This benefit was not present when patients had progressed to require advanced life support measures. The World Health Organization contradicts the use of this medication based on a large observational study that showed no benefit on the treatment in hospitalized patients. Ivermectin, on the other hand, is a medication that has shown a correlation decrease in reported cases in some populations. The retrospective analysis put this antiparasitic medication as a potential prophylactic alternative for the virus if clinical trials are able to determine that ivermectin is responsible for this correlation. In laboratory experiments, it decreased viral replication. Therefore, more studies are needed to determine this drug's potential preventive benefits. Honorable mention for COVID-19 treatment methods go to the prone positioning. This involves placing mechanically ventilated patients face down, allowing for better lung function. Despite its physical limitations, this technique has also shown some potential benefit even before the patients require ventilation. Amongst the adjuvant therapies are vitamin C, vitamin D, and zinc. Although they lack strong randomized clinical trials for the treatment of COVID-19, their use has been proven to be safe for most patients. The control of chronic medical conditions, on the other hand, such as diabetes and hypertension, decreases the risk for complications from the infection as well.
In conclusion, bamlanivimab could prevent progression to hospitalization when given early in the disease. Remdesivir may decrease the duration of hospitalizations of patients requiring oxygen who are not intubated. Dexamethasone can be used to decrease mortality for patients who receive oxygen, especially those who are on mechanical ventilation. Given the limited treatment options, patients at risk should maintain good control of their chronic conditions.
As vaccine becomes available, the consequences of the infection are dependent upon the prevention of the disease spread. Your role is critical to protect your loved ones as much as yourself. This is the importance of physical distancing, hand hygiene, and mask wearing. Contact your physician if you have any concerns regarding your health, and don't be afraid to visit your nearest emergency department if you develop symptoms that are concerning to you, especially if you are experiencing shortness of breath or chest pain.